The hunt for the sixth person infected with the Brazilian variant of the virus is moving at a rapid pace. Such is the urgency of identifying the person who forgot to put their name and address on the test paperwork that public health teams have even tried tracing the kit back through the postal system. Detective work that's paying off.
We've identified the batch of home test kits in question. Our search has narrowed from the whole country down to 379 households in the southeast of England, and we're contacting each one. We're grateful that a number of potential cases have come forward following the call that we put out over the weekend.
So just how concerned should we be about the P1 variant? The first comprehensive study of how the virus overwhelmed the city of Manaus in Brazil gives some clues. First, it spreads more easily. Researchers from the UK and Brazil estimate that the variant is between 1.4 and 2 times more transmissible than previous versions of the virus circulating in the city. Second, it evades the immune system. For every 100 people who developed COVID-19 in the first wave last spring, between 25 and 61 were likely to be reinfected. Third, it's not yet clear whether it causes more serious infection. People who developed COVID-19 after the P1 variant started spreading in Manaus were between 10 and 80% more likely to die. But the researchers can't be sure whether this was because the virus was more lethal or because people struggled to get medical care. Hospitals ran out of oxygen because of demand. The key question is what this means for the UK. For starters, the scientists say just 6 cases are unlikely to be enough to spark an outbreak. And secondly, the P1 variant may not have a competitive edge over other viruses in the UK. It has the same N501Y mutation as the Kent variant. Both spread fast. But the Brazilian variant shouldn't overtake the existing dominant version of the virus. Now, vaccines haven't yet been tested against the Brazilian virus, but scientists say that shouldn't slow the rollout in the UK. Bringing cases down to low numbers will give the test and trace system a much better chance of identifying people infected with the new versions of the virus.